For 50-year-old Carlos Macias, it has been a struggle to put food on the table. He lives in Caracas, Venezuela, a country gripped by economic crisis.
We limit the things we buy, especially in personal care products, because you have to choose if you need to buy toothpaste or rice. If I don't have enough to eat, what should I buy, toothpaste or rice?
Sometimes forced to eat only one meal a day, COVID-19 has made the situation much worse for his family.
I was working as a carpenter, but now I'm not working because people aren't hiring. Some people are scared somebody will infect them with the virus, and others don't have money to pay.
The virus means that millions more people around the world now have to choose between food and other basic needs for themselves and their children.
If we look at the COVID-19 effects, our estimations are that we will be between 83 and 132 million people going into undernourishment in addition to what we have today.
That's in addition to the estimated 690 million people who went hungry last year as a result of poverty, protracted conflicts, and extreme weather patterns. That means that by the end of the year, when the impact of the pandemic on economies can be better quantified, 1 in 10 people around the world would be hungry. But the problem isn't because there isn't enough food to go around. It's the lockdowns and the closures of businesses and schools and the impact of the global recession. The International Monetary Fund expects global growth to contract by 4.9% this year.
The effect of the recession is huge, and that affects food access. So food is available. We have food available in the world right now. What we don't have is capacity to buy food.
Mobility restrictions and disrupted food supply systems make food less available and accessible for many people.
The pandemic has laid bare the inequalities faced by vulnerable populations, especially in regions where economic and social safety nets are lacking, including for children.
There are lots of closures and mobility restrictions due to COVID, but the biggest impact was really the overall universal almost closure of schools, and that really impacts children who rely on school meals for their nutrition.
In a year that's also experiencing other outbreaks like Ebola and African swine fever, as well as locust swarms across Europe, Africa, Asia, and the Middle East, the fear is that COVID-19 could thrust the world deeper into a hunger crisis from which it cannot fully and quickly recover.
We're already facing hunger. What's coming next is starvation, because when the second COVID-19 wave arrives, there won't be enough food.
I'm Li Ling Tan for CGTN, New York.